like I said in the beginning, my name's Eric. I'm going to be helping you out here this afternoon, being one of your co-hosts with Patrick Phillips, the founder of American Business Systems. And today we're going to be talking about, can anyone earn a seven-figure income with medical billing? ABS has been around for 27 years. Out of that 27 years, I've been associated with ABS in some form or fashion for over 13 years. And I appreciate the Phillips family. They've seen my children grow up. Now they're seeing my grandchildren grow up. I've seen their children grow up, their grandchildren grow up. So ABS is an incredible family of working together here at ABS and serving folks, again, like yourself, that want to get involved in the medical billing field. It all stems from, obviously, having a platform in which makes it easy for you to be able to win business, but then also to do the business. There are a lot of different medical billing softwares out there. Patrick and I did one not too long ago where there are still people pushing out their software using DVDs or CDs, and you're having to load it on your computer. That might be good for one doctor, but if you're doing multiple doctors, you have to have a web-based system. That's what iClaim and EMRX is. It's an award-winning system there. As you go through the investment here and you go through our training, at the end of that training, you will be certified as a certified medical revenue manager. And yes, that is a legitimate certification. It is backed up by a group called the Medical Revenue Management Association of America, and they're the ones that issue out that certification to you. And there's their website. You can go find out some more information there about MIRMA. Here are all the different solutions. Again, ABS keeps adding more solutions to their suite of solutions here at American Business Systems. Obviously, iClaim and EMRX and iDocs now. And we're going to talk a little bit about each one of these as best we can within the next hour here. So we've got a lot to cover. Obviously, a ton of information to cover here. So we're going to get right into it. Let me introduce you to my co-host this afternoon, and that'll be Patrick Phillips. Patrick and Linda started this business. Actually, Linda is the founder of the business because she was actually doing medical billing way over 30 years ago. And from what has turned in from a home-based business for them, they've learned how to share that information with others and see people just like yourself start in the medical billing business. He's also written several books here. One of them, The New Thriving Medical Practice, is for yourself to be able to use in your marketing, and we'll briefly talk about that. He is also on the editorial board as a contributing author to the Billing and Coding Advantage magazine. And Patrick, look, without further ado, here's our pictures. Let's put both of ourselves up here on video. So there you are. Good to see you, sir.
Hey, Eric, how you doing?
I'm doing very well. Thank you for joining us this afternoon. But, you know, when we're looking at the market, you want to make sure that there's some growth. And I found this yesterday, and I thought, gosh, this was published March the 22nd. Today's the 24th, so we're talking 2 days ago. This is a lot of money, it seems like.
Yes, Market Watch came up with this, and as you can see there from the title and the very last paragraph on the screen there, this market, this revenue cycle management, it's called. That is, you're managing the revenue cycle of the medical practice, helping them collect their money from the insurance companies and the government agencies. This thing's growing, expected to grow by $33 billion, Eric, by 2026. That's just 5 years from now.
Right.
That is a growth of 10.3% per year.
Yes.
It's just incredible. If there was any industry that you were researching right now, folks, to try to find what should I get into that I think will have a future to it, believe me, healthcare and the technology that's all changing daily, that's tied to this field, it's just a wonderful match made in heaven.
Exactly. Yeah, it's huge. It's a huge market, and folks, you know, I'm sure that you're probably looking at American Business Systems, but you may be looking at some other industries as well. It could be restaurants. It could be any of the other business opportunities. It could be another medical billing opportunity out there. I think what we are going to share with you and show you, not only from some testimonials that we're going to share with you and some videos here in a little bit, but even the additional route in which medicine is taking, and then ABS taking the advantage of jumping on that and sharing that with their licensees. And folks, let me also say this: very rarely are you with a company that would year by year want to see about increasing the investment. ABS has not increased that investment in some time. Now, it could be very soon. However, when they do add another service line, there's no additional fees to go along with that. Patrick, before we even get to the next slide, just let's talk about, are there any hidden fees? What is all of this about? Is it a one-time thing, investment? Why don't you talk about that, and then we'll get to the next slide, because it's just more about growth there that we want to talk about.
Yeah, Eric, if you could go back to our stack of boxes, I want to talk about those other revenue streams that we have available to people, because folks, a lot of these services that you see here that are additional services you can offer to the medical practices, they all help with their cash flow. They all help with their revenue. They increase their revenue, they save them money, they protect them from Medicare audits. There's all kinds of good stuff that you can offer. They're all optional, but they've all been added over the years one by one, and we have not increased, our license price for our opportunity, kind of like a franchise fee. We haven't increased it whenever we've added these new things. They're always just given to our licensees, because here's the little secret, nobody will tell you, but we make money on all of these services when you offer them to the doctor. Just a few pennies from each transaction, but folks, that's how we make our ongoing revenue as a company, is from the different services that you can offer to the doctor. Now, you don't have to offer any of those. All you really have to do is do some billing for the doctor. If that's all you want to do, this is the opportunity that you're looking for. That's why we haven't gone up on the price. Eric, there's another company that charges almost twice,
right.
almost $50,000 for an opportunity, and they don't even have a cloud-based system. They wrote the software back in the 90s. It looks and feels like an old Windows-based put together, patched together program. It's not anything that's for today's age like our system is, but they charge a whole lot more money. Now, why can we do that? Because I don't want to raise that level of investment so high that we can't get enough people out there. Eric, as you know, we do not have enough people out there doing this service for doctors, even after 27 years. There's just more doctors graduating from college every year than we can get to.
And I saw in the news the other day that there's going to actually be another doctor shortage. So there's a lot of things that are going and increasing and growth, and with a little bit of doctor pullback there's going to be a great deal of need for medical billers or revenue cycle management. I put this one in here too. This one I pulled up and found this was just March the 11th of this year. But it says here in this middle paragraph here, it says the back-end revenue cycle management market. So this is the market analysis, this group. It says it's expected to witness growth in upcoming years due to factors such as increase in target patient population, which mostly includes patients suffering from cancer, tuberculosis, and cardiovascular diseases. And folks, let's just share that with you real quickly, because one of the solutions that we have here at ABS that you're going to find out deals with these specific areas. And, cardiovascular disease is on the rise, hypertension is on the rise, diabetes is on the rise, and these doctors can't keep up with it, but they need solutions, and they need billing for those solutions, because the doctors need to stay in business so that they can help take care of these patients moving forward.
Now, I know some people on this webinar today don't even really wrap their brain around what we do yet. Maybe you haven't gone to our website or spent much time reading our information so far. This may just be your introduction to all this. So don't let it overwhelm you. It's just medical billing for doctors. You're just doing their billing for them instead of the staff inside their own office. It's less expensive for them to outsource it to you, and they actually get more money pulled in, because you, making a small percentage of everything that you collect for the doctor, have that incentive that their staff don't have. So after saying all that, Eric, this past year though, this whole pandemic, the COVID-19 thing, has really done something wonderful for this industry. Like it just says right there in that middle paragraph, this is going to witness growth due to factors such as an increase in the patient population. In other words, older folks, right? We know that
Correct.
the baby boomers, they used to call them, are just heavily into their retirement years now. So what a
Right.
perfect time to be involved in something that helps those people and helps the doctors to manage their patient load. So let's talk a little bit about this thing
Yeah.
called patient virtual care.
Yeah. And I'm glad you brought that up because that leads right into what we want to talk about next here. And like I mentioned to everybody earlier, you saw those little white boxes that Patrick had there. You don't see virtual care on one of those little white boxes there. Now, you saw telehealth on there, but not virtual care. And what's happening here is that there's been such a shift, again, as Patrick mentioned. Now, folks, this is not from Patrick, it's not from Eric, this is from Forbes. And if you'll see down there at the bottom, we have the URL link. That's why we want you to go down and print out that handout there. Look at what it says here. It says the future of remote patient monitoring and the role of business leaders. That's you. And ABS now has remote patient monitoring as a virtual care solution for you to share with your doctors to help them increase revenue and take care of these patients. So you can see down there at the bottom of this article, it says COVID-19 led to acceleration in the use of telehealth and home health monitoring solutions as health systems sought effective ways of delivering care while protecting patients from infection. Although the pandemic will eventually fade away, look at this, folks. The market for remote patient monitoring is another story. Now, Patrick, I don't think in billions of dollars. I think in maybe thousands,
Right.
maybe 1,000. But look at this. The global RPM market is on pace to reach $117.1 billion in the next 4 years.
Yeah.
Compared to what it was in 2020, 23,000, it says that's a five-fold increase in just 5 years.
And
You know,
Eric, as you know, we're just rolling this new service out. In fact, we thought about rolling this out as a separate business opportunity franchise because it's just got such huge potential for money. That's why today's webinar on, can anyone make a seven-figure income? We're going to show you that that's possible. Not
very
not
possible.
just because we've added this new service. This will bring a lot of more people into that category of seven-figure revenue earners. But we've even had people already just with the medical billing bring in seven figures. So we know it's possible. This one I've debated whether or not this ought to be just sold and marketed as a separate service to doctors. It's so huge that within the next 4 or 5 years, there are going to be millionaires made in this industry just because of that service.
Exactly. There's no doubt about it. So again, what brought you here today to the webinar is can anybody earn a seven-figure income? And I think just without getting into the integral parts as we're going to try to do in the next 40 minutes with you, hopefully you can see that we are talking about things that are on the cutting edge of technology and supplying some things that have been there for a long time. You take medical billing, revenue cycle management, you couple that with some of the new technology that's coming out, and you bring all of it together where you're helping the doctors increase their revenue, you're increasing their revenue, but then on the other side, you're helping your community even healthier. So Patrick, let's first of all just kind of get into the nitty gritty stuff about the medical billing part of it. And it said here in the New England Journal of Medicine, it says that their market analysis says that 24 cents of every dollar is wasted on administrative and billing expenses. Our licensees can cut that by a third, if not more.
Yes, because as I mentioned earlier, folks, you're going to be charging the doctor. What most of our licensees do is charge anywhere from 6 to 8%. That's a good medium of what they charge the doctors, of all the money that they've actually collected for the doctor. You see, so for every extra dollar that they collect for the doctor, then they make 6 to 7, 8 cents, which doesn't sound like a whole lot until you start figuring that some doctors bill $100,000 a month, Eric.
Yeah.
Right? So now we're talking about $6,000 to $8,000 a month that our licensees are making just doing the medical billing for doctors because of there's hidden costs there for doctors to do that. I think our next slide kind of breaks that down. Look at this, folks. This is just incredible what a doctor can spend inside their own office. You see the two columns over there, in-house costs and outsourced costs. Well, what they would pay you based on the numbers that we have there in this chart, and you should print this out and kind of examine this more carefully, but based on 100 claims a week that you're doing at about $100 a claim, times 52 weeks in a year, times even as low as 6%, the doctor's only going to pay you $31,000 only. Eric, that's more than our investment in this business. Our license fee is only $28,000. So
Correct.
you can make a $31,000 return from one doctor, but look what the doctor would spend if they keep it in-house. They've got employees, payroll taxes, workers' comp insurance, errors and omissions insurance, training costs, leave coverage, employee benefits, and hardware, software, IT support. All those hidden costs, Eric, brings it up to $65,000 a year that a doctor would spend versus the $31,000 they'll pay you to do their billing. So you see, folks, we're not selling anything but money. Doctor, what if I could save you, what is that, $30,000, $34,000 a year,
Right.
and take all the headaches away from you?
And then you're making that money again. So you're helping yourself, you're helping the doctor, you're reducing a lot of the administrative headaches in that office. So just on a scale for doctors, that's pretty huge. Now, we're at a juncture here, Patrick, and I know that you and I both want just to kind of listen to an interview that you did with one of our licensees, Laura Dean, because again, asking can anybody make a 6 or 7 figure income? This is a great time to kind of listen to one of our licensees here.
Now, Laura, give us a feel for how you started. First of all, well, let's do this. Let's just begin with where you're at right now. Tell us about your business, how big it is, how many clients you have, how many staff you have, and how much money you're going to send me each month.
I mean, yeah, right. Well, that last question is nothing. But to get into the grind of the day-to-day business, we currently right now are doing the outsourced billing for about 12 practices, and we actually, which is really exciting, have 4 proposals out on the table right now. The one proposal is actually in the final phases of, we're just waiting to kind of get all the contractual things in place and then get started with them. We range anywhere from primary care to, we've got behavioral health clinics, we've got therapy clinics, we've got DME companies, we've got an ortho clinic. We actually do some toxicology and pathology lab for some of our physician offices as well. I mean, so we have a broad spectrum of the different types of clients that we have. Some of them being, very small practices, and other ones being large ones. We, have a clinic that has 13 physicians in it, so it's a big daddy. But then we have, a DME company that, is pretty small. But we now have grown. We have 8 staff members, which is really exciting. But over the last year, we've grown a lot with a lot of our clients, and it's been an exciting year for us. It's even more exciting that 100% of those referrals have been from physicians that we currently do billing for. So once you get out there and once you get started, and once you make a name for yourself and you treat your clients well, it's really exciting when you get a referral, that another physician has given for you, to have another new client. So like I said, it's grown really fast, and it's been really exciting. And people question, all the changes with insurance, things changing, and does that affect you? And no, it doesn't at all. Actually, everybody still needs care, and primary care physicians and all types of practices aren't seeing a dip in their in their clients as well either.
Okay, so Eric, I think everybody probably saw that I had to update that. She said she had 12 clients at the time, and as you saw, as of this month, she has over 30 clients. Now, let that sink in for a minute, because we're going to show you what kind of return on investment you can have in this business, folks. And this is a real person who really exists, who really runs this business out of her home. I think she's California, I forget where Laura's at. But the point is, folks, we got folks from coast to coast that have done this, folks, and they have no background in this industry whatsoever. Now, how is that possible? because we've come up with a way of teaching you what you need to know so that you know at the end of our training more than 99% of all medical office personnel and doctors about
Exactly.
the revenue cycle management. So I think that's pretty exciting because, well, Eric, I think we're about to show some return on investment here.
Yeah, let's do that. Let's kind of go and we'll direct you to where you need to go on the website. So if you go to avsystems.com, across that title bar there where you see About Us and Business Package, you can see a link there that gets you to the income potential. So what we're going to do there, simulate this through a couple of screenshots here, but you can go in there and live and play around with it and just kind of see the numbers of where you want to be. So what we have already embedded into that calculator is that we're just going to take one doctor that sees 20 patients a day, open 5 days a week. So you're going to charge 7% on an average claim of $100. Now, folks, again, these numbers are not blown up numbers. Matter of fact, I spent a little bit of an afternoon yesterday with a doctor that says, their average claim income ranges from anywhere still from $100 to $110 per claim. So you can see that we're just right at that bottom line of what you think about as claims for reimbursement. When we click on submit that, that'll bring you back of what your potential money that you can make. So this is your potential revenue of what you can make with one doctor that's doing that. So you're bringing in a little over $3,000 a month in income. That's $36,400 a year. Now, why is that significant? Again, that's actually over your investment here with ABS. As Patrick has said, one doctor, if you think about it, one doctor can bring your ROI back into your company. So if you think of this as a company and you're going to spend, $28,000, $29,000, your question should always be, how do I get that revenue back in? How do I get that ROI back in there? So before we talk about anything else, let's kind of just talk those numbers through so that you kind of see how this is broken down. Again, if you've got one doctor that, again, sees 20 patients a day, again, at $100 per patient, that doctor is seeing revenue anywhere from 20 to 24 days a month. But let's just say it's 20 days or 20 patients per day. That's $2,000 per day. And so you're going to be averaging anywhere from $40,000 to $50,000 that you're billing for that doctor. When you break that, yep. So when you break that, okay. So when you start breaking that down, so you got $20,000 a day at 7%. You're making about $140 a day. And folks, this is a good point to bring in, and that's only going to take you probably less than 2 hours a day to do that. So Patrick, you take today's economy, and people are trying to even figure out, what can I do even part-time? This is one of those areas that you can literally do part-time, make $140 a day, making $36,400 a year or $700 a week. That's an incredible start for some part-time work.
Yeah, they call them, well, they used to, maybe it's out of date already, side gigs. This could be a good side gig for somebody. And Eric, as you know, I've interviewed more than 100 of our licensees over the last few years and months. And many, many of them have said, I started this part-time, I had a full-time job, I did what you guys told me to do to get my first client. And once I had that first client, it just grew from referrals. And it does. Now, do the math on this right here. Let's just round that out, 36,000, okay? I'm going to do it times 30 because they said they had 30 clients. 36,000 times 30 is $1,080,000. $1,080,000. So there's where we came up with the number, a 7-figure revenue, folks. Yes, it is being done. It is possible. That's assuming, of course, all your doctors were the same doctors. They're not. Some of them, she said, had 15 clients in one practice. Others are just small, durable medical equipment companies or therapists. You can bill for any kind of medical specialty that's out there. Eric, there must be 60, 70 different specialties.
Of course. And again, folks, if you take a look at what we were looking at here, I'm going to go back to these numbers here. We're talking one doctor, and this doctor's only seeing 20 patients a day. Folks, that's basically that's part-time for a doctor. I mean, doctors are seeing 25 to 30 to 40 patients a day. And then some of them, if you go to specialists, if you're going to see a surgeon or you're going to see a cardiologist, that average claim amount is going to be $150 to $175. So you change a few numbers here, you're going to see how quickly those numbers quickly add up to, for a good amount. And again, let's just take this and let's just adjust one number. Again, let's take that from one doctor to 5 doctors. Again, seeing everything else stays the same. So if we just change it by one doctor, Patrick, there's where most people are wanting to say, hey, I'm just interested in making a 6-figure income. If I could make $100,000 a year, I'm comfortable. And here you're at $182,000 with 5 doctors' offices.
And one person can do the billing for 5 doctors easily, as you saw from the numbers. 90 minutes for one doctor, then times 5, that's what? Well, it's very few hours a day.
Yes.
Even if it was a full, even if it was a full 40 hours, I think there's a lot of people would love to be able to work from home, never have to get up and fight the traffic, and still be able to earn this kind of money, Eric, literally from anywhere in the world. If you have an internet connection and a laptop and a cell phone, you are running this business from literally the shores of Tahiti.
Yeah, wherever you like. And folks, let's also remind everybody, we're at the bottom of the hour, so if you've got any questions, feel free to type those questions in, and we'd be more than happy to see what we can do to help answer some of those questions. Now, Patrick, let's shift gears a little bit, because we've been talking about one service line. Really, we've been talking about medical billing. That's all. We haven't talked about any of your other services that you have.
Right. And yet, here they are. I haven't actually counted them up, 7, 8, 9. I lose track. I literally lose track because we just added the telehealth that you see in the bottom right-hand corner there. That's because, folks, we are in a dynamic industry that's constantly changing. Rules and regulations change. We keep our licensees up on all this, of course, because that's our business. That's what we do and have done for 27 years. So since we have a lifetime support, once you've joined our network by paying our license fee and going through our training, you are a licensee for life, and we're going to support you for life with all kinds of cool stuff, including these other services here that you can also make some extra money. Eric, there are webinars you and I have broken these down and added some of these in. Yeah. We don't really break that down in detail here, but we can tell people at least what kind of money can be made with some of these.
Of course. I mean, and let's just kind of talk through these, because obviously a lot of people say, well, do doctors use these, and do other licensees use them? They absolutely do. They could be used for different means. It could just be a door opener. It could be asking the doctor, hey, do you have past due collections that you're trying to get caught up on? How about if I could show you that I can help you increase those past due accounts by 3 times of getting that back into your practice there. And so that's what Quick Collect does. And so instead of having a collection agency involved, you've got a service that's involved. That's an automatic service. And as we go through these, as Patrick mentioned, there have been some other webinars that we've kind of gone down and we've broken what kind of money you can make off each of these. But again, you're not necessarily, we're not going to go through all that. Patrick, talk about AUTOCARD. I think you were just showing me one of those new ones that you got up and out that does it. That show me it's like real cards. It's not anything that's, there you go.
Yeah, it's a real card that came in a real envelope here in the mail to me. I sent it to myself. As you can see, it looks like it's almost hand addressed. It has a real stamp on the envelope, because, folks, this has overtaken email. Look, with email, it's too easy to delete stuff, right? So you keep your finger over the delete key, right? When you get a card like this in this kind of envelope in the mail, there's no way somebody's going to throw this away. I'm guarantee you they're going to open this because it looks like, well, it could be a card from their grandmother with $5 in it for their birthday. Yeah. So you just don't throw away a greeting card type card. And look, it even looks, Eric, I don't know if you can see that or not, but see that? It looks like I wrote that by hand. And that's all computer generated. So folks, think of it this way. It's an automated online system, but when you push the button to send the card, it's done automatically behind the scenes for you. All that printing, stuffing, stamping, and mailing is done automatically. And Eric, this thing not only has increased the patient, show up for doctors, but it's also helped our licensees to do their automatic follow-up to the doctors that they talk to, who maybe they don't sign up that day, but you want to stay in contact with them. AUTOCARD, it's called. It's a fantastic system, and it's all online, cloud-based. There's over 15,000 different cards that are pre-designed, ready for you to put your message on the inside. You can even add your own logo and photo of yourself and your staff if you want to. It's just wonderful. Can't say enough about that one.
You bet. Hey, we did get a question in from Reginald. I'm gonna address that while we're still here on AUTOCARD. He says, in my research, there appears to be a lot of medical billing companies. Could you give me an estimate of how many medical facilities and physicians that are actively looking for a medical billing provider? I would tell you, Reginald, first of all, I would agree with you that there are a lot of medical billing companies out there. But I want to adjust your thinking just a tad. You're not just a medical billing company here. You're finding, again, that you are a certified medical revenue manager. And you're going to find out the importance of that as we kind of keep stepping through some of these service lines, especially when we kind of dived up a little bit more deeper into the virtual care side of it. Because what's going to happen is that you know that anybody does business with anybody that you know, like, and trust. And if I keep bringing you solutions like AUTOCARD or Quick Collect, or this next one, which is AUDITGUARD, which has to do with doctors making sure that they're getting their correct codes out the door and making sure that they don't have any infractions and they're going to get penalized or anything else like that. I want you to see that you're going so far beyond just what you think of. I've got a diagnosis code, I've got a procedure code, and I'm going to get the doctor reimbursed. This is so much bigger than that. So are there facilities, medical facilities, are there physicians out there that are looking for this solution? I'm going to tell you a true story that happened to me yesterday. I already told you that I was talking with a doctor, and we were talking business on virtual care. If that's what we were talking about. He says, Eric, I'm looking for a one-stop shop individual or company that can do my billing, that can help me with RPM or remote patient monitoring. I'm looking for one company that can kind of handle all that. So the answer to it is out there, Reginald. The answer is yes. How many of them? We can't give you a certain amount or a market research on there. But I'm going to tell you, there are doctors out there that are looking for just a place that they go, I need Reginald, or I need Michael, or I need Susie, or I need somebody to kind of help me, because they're getting so much information in at one time, especially for COVID. They're trying to just keep up. And ABS behind the scenes on the support side gives you all of that support that's going to help you go out there and market. Now I'll get off my soapbox.
No, that's a good summation. And Bharat says something similar to that. He says, if a doctor's billing is already handled by any other agency, why will they change? Yeah. Hospitals must be having a billing system. Why does a doctor need an individual billing system? This is kind of but for people who are not familiar with this industry, it's kind of hard for me to wrap my brain around someone who does not realize that about half of the doctors out there outsource their billing already. I mean, it's a huge market. That's how huge the outsourced billing market is, that a lot of them have already decided that. Others have not made that decision. They want to keep it in-house. Maybe they're more private. They want to feel like they have more control over it, guiding their own people and so forth. But it's a mistake to do that. And many, many articles have been written showing doctors that the advantages of outsourcing far outweigh trying to keep that in their own in-house system and keep up with all those software updates and the changes in the codes and so forth. That's just not something the doctors should be focused on. They should be focused on us, the patients.
And both to Reginald's and Bharat's questions, I mean, they're both valid questions. These are the questions, ladies and gentlemen, you need to be asking. You need to be asking these questions. And so we encourage you to continue to keep doing your research. Are there 100% of the doctors out there looking to change their billing? The answer is no. Not every doctor out there is doing that. Are there doctors that are out there that need to and that they're trying to figure out a solution? You bet. There are a lot of doctors still out there trying to figure out, hey, like Patrick said, I want to stay independent. I've got my wife doing it. I've got my husband doing it. I've got my partner doing it. There's somebody out there doing my billing. I may even have it outsourced overseas, and I really want to get it back here to the United States. There's so many doctors out there. There's so many specialists out there that you're going to find one or two out there that are going, you got the solution that I need. And if you can show the doctor how you can help them increase their revenue, which is why we're going to share with you at the end of this webinar, the help that you can kick the doors down, I would say, by the virtual care part of what ABS has now, you're going to find out that you're going to be able to get past the glass, so to say, get past that gatekeeper and help some doctors out there with a lot. So, Patrick, again, we could go through each one of these solutions. Each one of these solutions obviously can help you make money, help the doctor bring in revenue, whether it's CODERITE, iDocs now. I mean, Patrick, I mean, you and your staff have really taken the time over the years to add each of these different services that benefits the doctor, benefits the licensee.
Yeah, and CODERITE is just one of those. See, we have a lot of questions about people getting into this industry. To do the billing for doctors, don't you have to be a certified coder? They know that there's courses that you can take online, really, that cost thousands of dollars and take years to get through. But then you get this certificate that says you're a certified medical coder. Look, there's nothing magical about that. And since our codes are all built into our cloud-based system, you don't need to know the codes. The doctor is the one who needs to know the codes. So when they get involved in our system, they have them, all of them, inside of our system, and they don't have to look them up in any kind of book or anything. It's all right there on their iPad. And CODERITE is just one of those services that you can offer. In addition to having this codes inside of our system, we have certified professional coders on board that do everything for you to help the doctor make sure that they're coding correctly, meaning they're not undercoding, leaving money on the table. They're not overcoding, getting in trouble with Medicare. They're coding the way they should be. And our certified coders can make sure they do that with this service here. It's a terrific add-in service. And some of these are good door openers, Eric. Maybe the doctor doesn't want to talk to you about doing their billing, but they do need a coder. They don't want to hire a coder for $40,000, $50,000 a year to sit in their office. So we can offer them coding services just as a get in the door type of service.
Patrick, we've got one more little snippet of an interview that we want to, I know you wanted to share. This one's.
All right, now I didn't ask you if I could share this email from you, this little note that you sent me, Beverly, but I'm going to throw this up here, and let me make sure that I didn't, this was in July of last year. But anyway, I just thought it was a nice little note for you that you sent to me. You remember sending something about one of your clients and you were sending an invoice?
I did, and I knew that was the email you were going to bring up, yes.
Yeah, we sent that around the office here. Everybody wanted to see that because, folks, if you look closely here, Beverly is saying, she actually wrote this to Jordan in our office here, says one of my clients is receiving an invoice for $25,663.93. That was a nice month for you there, wasn't it?
That really was, yeah. In fact, it continued for several months. So that was very, very nice.
Now, just so people kind of wrap their brains around that of course is not, well, that is the money that you made for the doctor. Is that right?
That is the money that I made, yes. This particular client is a pathology doctor, and the billing that we were doing for her netted her $500,000 a month. And so then I just took my percentage off of that $500,000, and that's what I billed her for our services.
Wow.
Now,
There we go. Yes.
If people would just get out their calculators and realize that with one doctor, one client, she billed that one doctor $25,000 for 1 month's billing work on her part, and that's her net that she puts in her bank account.
Yeah.
Again, do the math, folks, and you'll see that, yes, we say that, look, here's the disclaimer. Most people don't make this kind of money. This is not typical. It's just like those diet ads you see on TV. Most people are not losing 100 pounds a month, but there are some who did, right? So we're just showing you some great stories here because, Eric, I don't know about you, but I don't need to know what the average person out there makes in any business. You tell me, what is my possibilities? What are my limits? What can I make? And that's what I want to hear. And as you can see, there is no limit in this business.
There's none. Barat's asking another question before we move on because we're going to start to wrap up here. Does ABS help us get in getting a business? If yes, how? And that's what we've been showing you, is that we do help you get a business. And one of the ways that I think we can help you get launched into seeing doctors and breaking through, like I said, the glass wall or the glass ceiling of anything. Because first of all, I think if anybody on today's call or will listen to this later on, you're probably thinking, if ABS could just help me get in front of some doctors, I think I can do what they say that we can do. And Patrick, we've already kind of talked about this. We kind of started off with it. We saw the growth that's in virtual care. We know that virtual care is hot right now. And let's kind of just talk about that real quickly. Obviously, you know, the health spending needs are ever increasing. And we're going to be talking about virtual care, but we're talking about, obviously, national health spending growth is huge as it's going through.
Yeah, this guy, by the way, Sean Kehan, he's with the Center for Medicare and Medicaid Services. He's with the government agency that actually deals with all this. And he himself is saying healthcare spending is expected to grow on average more rapidly than the rest of the economy. So again, Eric, there's lots of things you could get into and start businesses in right now, but some of them you wouldn't want to. I wouldn't want to be in the movie business, the cruise line business, or restaurants in a lot of cases.
Exactly. And folks, you know, one of the great things, again, with ABS and what you get with the investment at ABS is that you get all of the marketing material. So all the marketing material, again, has already been done. They've already got the ones out here for virtual care. Matter of fact, I got an email from Adam. We've got a couple more marketing materials that we're going to get out to the printer that supplies all the printing for all of our licensees, and we're going to get that up to date here very soon. But you know, you've got 8.5 by 11 slicks. You've got cards that you can send out. But let's start diving into what virtual care really is. It started, again, folks, with COVID, and it started with telehealth. Just, Patrick, can you believe it's been a year when we started seeing this? And I remember we were all kind of gathering around going, wow, how are our licensees going to survive? What are they going to do? How are they going to go see doctors and even market to doctors?
Right.
We have not seen a dip out of anything.
No, in fact, I've interviewed licensees here in the past year that have said, I've asked them all, well, how has this year's pandemic lockdown thing affected your business? And many of them have said it's doubled my business. I've seen more doctors because now nobody had heard of Zoom, before this. And now everybody knows how to use Zoom to have a virtual meeting with somebody. So it's really opened up the possibilities of talking with doctors and not even having to go face to face with them. They would love to meet with you at any time using technology. And look, it even says here in this article that the coronavirus pandemic has slowed the momentum in growth for the healthcare industry this year, but experts say COVID-19 has brought opportunities for healthcare startups to succeed and innovate. And that's what this telehealth thing did. It opened up the eyes of the doctors as to, oh, you mean now that the government's going to let me bill for a telehealth visit that I don't even have to see the patient in person? I'm in.
So that was May 11th. That was May 11th of last year. We're going to do a little path here. Come December the 8th, it says using telehealth for a more effective continuum of care. Look, CCM and RPM can improve outcomes, the patient experience, and your bottom line. So we've moved from not really doing any telehealth to a pandemic to telehealth now to what we know as virtual care, or what's called remote patient monitoring. And you can see here that this is a huge revenue potential for the doctors. And again, folks, remember, you're going to be trained as a certified medical revenue manager. Remember, a lot of your lead-ins, so Barack and Reginald and everybody's been asking some of these questions. How do I get in front of the doctor? How can I end up doing their billing? What's going to make me stand out from everybody else? When you walk in, you can say, doctor, I have a virtual care solution for you. I can help bring in revenue to your bottom line by helping your chronic care patients that you need help with, whether it's with glucometers, diabetes or blood pressure or, whatever it might be. I can help you bring revenue in. Let's talk about some of that revenue. Here is an article that came out in this last year, just a few months ago, from this attorney, again saying that evolving technology is altering the way healthcare is delivered. Remote patient monitoring is leading a transformation in primary and specialty care. Cardiology is one of the biggest areas. So, folks, here's a knife cutting both ways, so to say. You've got cardiologists who need help with their patients to monitor blood pressure, and they are some of the highest revenue generators. So if you get their RPM, you're going to get their billing, and you're going to get an incredible amount of revenue from these cardiologists. Patrick, you want to share anything else about just what this remote patient monitoring is all about?
Well, here's what's exciting about this, folks, is we have a technology partner that provides this service to doctors, and the doctors don't have to hire any additional personnel. They don't have to allocate any time for their existing personnel, nor do they themselves have to put in any time. I know you find this hard to wrap your brain around, but we're going to actually help this doctor remotely monitor chronic care patients who need that kind of monitoring on a regular basis. And we do that with our own registered nurses and physician's assistants and so forth, so that the doctor doesn't have to do a thing, but just basically sign them up on it. And then once that happens, Eric, the money just comes in. Now, folks, this was hard for me to wrap my brain around, but we've actually seen doctors who they have the potential of earning another $250,000.
Exactly. We're going to look at you. Now, that's on top of what they're already doing. And imagine going to a doctor and say, hey, I can help you increase your revenue, and you really don't have to do much. You sign your patients up for remote patient monitoring. This company that their technology partner for ABS does all the work. The doctor bills it out just like regular, and then they just pay for what they're contracted to monitor those patients. It's a beautiful thing because now it actually adds revenue before you even start doing the billing. Now, Patrick, if I were to come to you and say, hey, Patrick, I can help you earn another $250,000, and I can start showing that to you, would you be open to talking about your medical billing?
I wouldn't even care if you ever did my medical billing. Just show me the revenue right here. And folks, that's a great part about it. Maybe the doctor thinks they have their billing under control using their own staff, their own software, or maybe they've already outsourced it to another company. It doesn't matter. You can walk in and with this service, add this kind of revenue to a doctor. We're going to show it to you here step by step.
Yeah.
And now you're their friend, aren't you?
Yeah,
I
absolutely.
think at that point, they will be very open to talking to you about any other cash flow solutions you have for their practice.
Yeah. So chronic care management can bring in on a monthly basis per patient about $230 a month. Remote patient monitoring can do same thing for about $610. So if you take that and you take just 250 patients, again, this is the low numbers here, folks. This is what if you take these numbers. These are annual. These aren't monthly. This is over the year. But you can see how you could actually help increase that doctor's annual revenue nearly $250,000 just on 250 patients that have high blood pressure.
Yes, that's the one thing that you're monitoring for that patient, and you still can make this kind of money. Now, folks, is it possible for a doctor to be open enough in their thinking to be able to examine this? Well, maybe not, but guess what? We even help you close these doctors by helping do demonstrations for them using the technology you're watching today. Imagine us doing the demo of this remote monitoring to the doctor and answering all the doctor's questions before you even have to sign up the doctor on anything.
There's somebody on here, Cynthia says her husband had 2 cardiologist visits in 2020 and they charged him $350 for each telehealth visit. So
Yeah.
folks, that's hearing from one of your peers out there. Now, let's talk about what kind of money you can make. On average, you're making on that revenue, you're making $12.50 per patient per month. And again, if you look at this, folks, you're making $3,250 per month times 12 months. You've got $37,500 there with one doctor. And imagine again that you've got 10 or 15, 20 doctors that you're working with remote patient monitoring. And I'm telling you, 250 patients monitoring 250 patients is a low number. We're talking doctors are monitoring 500 to 1,000 patients each. So you could literally see these numbers just escalate pretty quickly.
Sure. I'm still doing some more math here on that just to find out, but that 37,500, you only need 3 of those to make $100,000 a year, and you didn't do a thing but sign them up. You don't do a thing. This is mailbox money, folks. Mailbox money.
Well, Patrick, we've got. I don't know how we're going to squeeze it in here. I've got an appointment I've got to get to here shortly. We got 2 minutes left at the top of the hour.
I know you've got another appointment. Why don't you just check out Eric, say goodbye. I'll take over from here and answer all the other questions and show them how they can get involved if they're interested in starting their own medical billing business. There it is. We're the only company that I know of, only franchise or business opportunity that I know of, that you can join us, go through our training, see all of our proprietary information, and if for any reason you don't think that this is the right business for you, you just ask for all your money back. Yes, we have given people 100% of the money back. How many? Less than 1%. And that's why, folks, we can offer that, because we know what we have, and we know once you've gone through our training, you'll go, wow, this is bigger than I thought it was. So what is your next step? Well, it's simple. Number one, you want to look over our downloadable research guide. Now, that's in every email that's ever been sent to you, a link to this research guide. It's over 50 pages, a PDF document that has more information than you'll ever find on our website. So be sure and ask your ABS rep for that. If you don't know who that is, there's the phone number and email in the bottom right-hand corner of the screen. Just call and say, who's my ABS rep? And here's what I'd like to get. Now, the other thing you want to do is browse our YouTube channel. Look, here's what it looks like. If you go out to youtube.com/whyabs, there it is right there. You'll see over 100 videos there that we've done over the years that we post out there. Everything we've ever done on every Wednesday for the past 10 years is out there, plus all those interviews I told you about of real people who've been through our training and what they say about us and our company. Step number 3, ask your ABS rep for an owner reference list. That's right, we have licensees from coast to coast who are ready to take your phone call and talk to you. They're running their own business. They'll tell you how they started, what their background was. You can ask them just about any question you want to. These people love us. They love this business, and they love telling other people about it. Also, ask for a live demo of our system, folks. We'll get online with you. Our demo people that you see in the upper left-hand corner there will get online. They'll show you a demo of the system, answering all your questions. Since it's a cloud-based system, we have to show it to you live so we can actually answer your questions live. And you can also depend on us to do those demos for your doctors. As you can see in the middle of the screen there, there's some of your potential clients watching the demo that we're doing, and you can be on the same demo there in the bottom right-hand corner. You and your partner or spouse can be watching that demo, hearing everything we say to the doctors. So we help you get the clients by helping you close the deal. This is what we do. Now, there's a purchase agreement involved in this whole thing, so you want to be sure and ask your ABS rep for that. It's only 4 pages, goes into detail as to what we're going to provide you and all about our guarantee and our training and our lifetime support and so forth. Then, after you've signed the agreement and funded your business with us, you can schedule your training. Now, our training is all done online, virtually, but it's with a real person. That's right. In the upper right-hand corner is one of our instructors. She's real. She's actually online, just like I am right now, talking to you using slides like this. and of course answering all your questions. Since it's just you and maybe your spouse or partner and the instructor, you don't have anybody else asking questions that they shouldn't be asking. So there's the 5 steps. Hey, I'm going to tell you, I'm going to leave that on the screen here and get to any other questions.